so good evening everybody. Today we want to talk about one rare procedure. I mean, we envisage that can be asked in the exam, although it has never happened in exam. Okay, and then this procedure I want to talk about is how to perform an ECG on a patient. Sometimes you are just there, and then when you are reading topics, you can just predict what the examiners can bring. And so that will inform our discussion today. There can be a dummy, and then you are asked to perform an ECG on a dummy. So testing where you place the leads, what will you do? So have you ever been in a clinical setting where you've observed ECG being done for a patient? And it might interest you to know that it is actually one of the requirements for a house officer. As a house officer, the nurse doesn't have to do the ECG. No. If you check your logbook, you see that as part of the procedures you are supposed to do, you are supposed to do an ECG, so that you'll be checked that yes, you went through the rotation. So it won't be surprising if they put a dummy there and in internal medicine OSCE perform an ECG for this patient. And if you perform it, I mean, the things you can be asked, then they will bring maybe one ECG and ask you to interpret it in the procedure station. It is not highfalutin, if you ask me. And so we want to just go through the components before we use one of our cells to demonstrate how we would perform the ECG. All right, good. So this is an ECG machine, a portable one. Okay, and I have countless times done the theory behind the ECG, so you probably know what I'm going to talk about. So the first thing I want to talk about are the electrodes of the ECG. The electrodes of the ECG. Okay, we are not going to be asked the components, but the electrodes, we need to know the electrodes of the ECG. So I'm going to pick some things here, and I think I showed them to you online, if you remember. So do you see them? So these are the, yes, 4 of them. These are the limb electrodes. You saw that when we went online, if you remember, when I was teaching ECG, we saw that this can even have community health significance. Where you have the red, I asked you to draw from this. Do you remember? So red, yellow, green, and black. The red would be on the right arm electrode, the yellow would be on the left arm electrode, then the green, and then the black. So that you can just picture how you draw the Ghana flag. Okay, so red, gold, green, and then the black in the middle. Do you understand? So I was telling you not to keep the colors in your head. And as you can see, Zadat, can you come? You see that this is a green, and then they've labeled foot. So there's no need to keep green, but well, we may go to the ECG machine where it has not been labeled, but ideally it is labeled. As you can see, look at yellow, left, and then what? Neutral, black, here. And look at red. Red is what? Right arm. So you are going to put it here, right? Like that. So we'll demonstrate that. So these are the what? The limb electrodes that Eindhoven spoke about when I was teaching the ECG. Okay? So you put one here, one there, and then one there. Then you create the Eindhoven's triangle. And you know the theory, how the leads are generated. Lead 1, lead 2, lead 3, like that. And AVF and AVL and AVR are actually augmented leads, isn't it? So after the limb electrodes, then we come to the chest electrodes. Again, I said that you don't have to memorize the color because it has been inscribed on those electrodes. So look at this. These are the chest electrodes. Do you see that? These are the chest electrodes. I think I have to use this. These are the chest electrodes, just like I said. So it can be named as what, C1 or V1. Chest, so red, chest electrode, then C3, okay, then what, C4, you have C6, you have C2, and then C5. So all you need to do is just inspect how they have been labeled, and then you know where to position all of them. Do you understand? Very good. So when I showed you the online picture, you see that I just showed you, so these are actually the knobs. So the electrode is actually connected to a knob. It is unlike this that you can fit on the hand. So the question is, how do you fit it on the chest? Then you have to connect the wire to a knob. You can just what? Press. Once you press, it sticks with an ultrasound gel. Do you get it? So these are the electrodes. All right. So assuming you've walked into a station and then you've been asked to perform an ECG, and you see that all of them have been connected to what? The connector. And it has been connected to the ECG. So the ECG has been programmed, it has a stylus there, there are papers there, and once you put it there very well, and then you press reading, it just starts reading, isn't it? Okay, so can we end this video?